Now, welcome everybody to another Zoom call. I apologize in advance. I have a sore throat and a cold for some reason. But here we go. Reminder to look at the member site for announcements and um, be checking there, just like last week's Zoom call had to be canceled to the last second. So apologize for that. And a reminder that you can self-schedule on our self-schedule page or on the member site or in a billion other places. So make sure you look at that. Okay, first question. I am currently trying vitamin C IVs, and the ingredients are vitamin C, magnesium chloride, potassium chloride, calcium gluconate. Um, does that sound like a combination? Is there a reason why I should not do that? No, nope. You can do that. That's just fine. They always in vitamin C IV bags. There's other minerals, and it has to do with keeping it in solution and keeping it aqueous for the ability for you to put it in your blood. So you don't really have a choice with some of these other things. They're not putting it in there for you to get magnesium or potassium per se, but they're keeping it at pH balance for your blood. So, yep, that is just fine. I use my Rife every single night for breast cancer for the past week. When I wake up at night and in the morning, I am very dizzy. I read in the Rife handbook to make sure you're drinking lots of water when using the Rife. If so, does that mean at night, or is it okay to drink enough adequate amounts of water during the day? Also, is it possible to program that the program on my Rife needs to be changed? I'm doing very well. Also, could the dizziness come from supplements I'm taking? So, the dizziness is, I do, so you get dizzy because you are, dehydrated. So that's the initial thought in this question is that the Rife Handbook is make sure you're drinking plenty of water. Well, every therapy, you're told to drink plenty of water. They don't want you to be dehydrated. And the reason is that cellular dehydration can bring about lots of other issues, and it can affect the effectiveness of different therapies. Um, However, dehydration is not going to is typically not your first thing you think of when you think of dizziness upon arising and dizziness upon awaking. Um, so you'd really want to ask a few more questions. If you're feel when you stand up from a sitting position, or you get up and stand up, or even sit up from a lying position, and you feel a little bit woozy, but then you hold that for 10, 15 seconds and it passes, and then you're fine. Really, what that suggests is adrenal insufficiency. So your adrenal gland kicks in a hormone that constricts your blood vessels, thereby increasing your blood pressure to shunt blood to your head so that you have adequate oxygen supply upon rising from a sitting or lying position. That's how fast that hormonal progression works. When you're going to sit up from a sitting position, sit up from a lying position, you literally get at least 10 points elevation in your systolic blood pressure because of a sympathetic tone stimulation, because of a hormonal release, in order for you to get adequate oxygenation to your brain. So if you don't get that, if that doesn't happen, that is a sign of adrenal insufficiency. So if that's the case, if the person says, when I get up in the middle of the night, I feel a little dizzy, and then it subsides a matter of a couple seconds to 20 seconds, and then I'm fine, but I just got to kind of brace myself before I start walking. That's a sign of adrenal insufficiency. So you really need to think about taking some adaptogens, some adrenal stimulation. We have plenty of adrenal type things to take. It can be a sign of low cortisol in the middle of the night. If you don't get, if that does not happen during the daytime, it's most likely you have enough and you have enough blood sugar. Could also be a sign of low blood sugar in the middle of the night. So I don't think it has anything to do with hydration, and I don't think it has anything to do with the rife. I don't think it has anything to do with any of your supplements taking. It's low blood sugar, low adrenals, and adrenals need sugar, and your brain needs sugar in the middle of the night. So if you're already on a very low sugar diet because of your cancer and you're keeping your glucose at low levels, and this is only happening at night, then it's most likely cortisol or glucose or a combination thereof. So um, I would suggest you try adding some adaptogens or eating some protein before you go to bed. So it's not about eating sugar, but it's about having, not being hypoglycemic in the middle of the night. So eating some protein that's going to break down slower will help maintain healthy, will do both things, will help maintain healthy um, glycogen stores in a source of glucose and a source of stimulation of cortisol at night. Regarding cancer in infrared saunas, can I go to my local tanning facility that offers infrared saunas, or do I need to go elsewhere? Yeah, if you want to do a sauna at the local tanning facility, sure, you could do an infrared sauna there. If it's a small little business and they have infrared saunas, you for sure go ahead and do that. That's fine. Um, yeah, and remember, there's lots of different types of saunas out there. Doesn't have to be near infrared or far infrared or mixed infrared. A lot of the companies that sell saunas really taunt they're selling their sauna, so they might advertise all sorts of different types of infrared in their saunas and stuff. But the truth is there's really very little true infrared, whether it's far or near infrared, in any of these saunas. So don't even worry about that. You're not using the saunas to get infrared. Um, well, I can see the red light coming out of the plate that's a far infrared sauna. Okay, well then, if it's a red light, it's not infrared. So infrared, far infrared, and near infrared will not have a color. It's below the red light spectrum. So if it is a red light, that is just red light. Is that red light therapy beneficial? Oh, maybe. I don't even know what the nano meters of the red light that is being shown. It might just be a colored light and it's not really doing anything to help you. It's the heat of the sauna that's beneficial. You're increasing your body temperature. So you're sweating. So you're detoxifying through your pores. Has really nothing to do with whether it's infrared or not. People ask that other question of, can I just go to an old steam sauna and, an old one where you pour, the water on the rocks, and you don't have to pour water on the rocks if you don't want the steam, but it's just an old heat source sauna. Yes, does the same thing. You're not getting any increased benefit no matter what the company does, what the company says in their advertisements that sell the saunas. There's really no infrared in the saunas. We have that true infrared heating, uh, infrared source that we sell, that hyperthermia that we sell. We don't sell very many of them because it's not necessary for most people. And it doesn't go that deep. It only goes an inch or two deep. So if you have a tumor site that's deeper than that, it's not going to do anything for you. So it's really for breast cancer. It's a good application for it. However, there's no light that comes from it because it's 100% true infrared. So it doesn't show a light. Plus, it doesn't really heat that much. It's just warming at best. So it's not a source of heat. So there's a lot of just false information out there, especially by these companies that maybe it's 1% infrared that's actually being produced, but it's just a source of heat. Should I be concerned about the amount of EMFs in the bedroom if the Rife, the generator, and the laptop are all on all night? Currently, I don't even leave my router turned on at night. So, where do you get EMFs from in your house? Well, you get EMFs that are produced locally through electronics, through number one source of EMF in your house produced locally is your Wi-Fi. That's the number one produced locally EMF. But you also get EMFs from your cell phones if they're plugged in next to you all night long, because those are coming not locally from the cell phone, but from the cell phone tower. It's still connecting all night long. So you shouldn't leave your cell phone plugged in next to you in bed. So the other sources of locally produced EMFs are dirty EMFs, dirty electricity from your wiring of your house. Everybody's house is hardwired. And the number one source of external EMFs that's coming from the outside of your house is the cell phone towers. And your outside meter, your electric meter. So getting your meter cover can be really helpful. You can't do anything about cell phone towers that are near you except moving away from one. Um, are you getting EMFs from the Rife machine, from the generator itself? No, you're not getting any EMFs from the generator. Are you getting EMFs from the bulb? No, you're not getting any of them. Are you getting EMFs from the laptop? Yes, if you leave the laptop on. That's why we suggest you close the laptop, putting it to sleep. It's not producing any more EMFs. You can get an EMF reader because we've done that and measure it. It's not producing any. So no, you do not need to be concerned about EMFs in your bedroom from the Rife generator and the laptop if you close the laptop at night. So again, number one source of EMFs in your house produced locally is your Wi-Fi. So it's the right thing to do. Turn your Wi-Fi off at night. Dirty electricity. So think about getting a mitigator for dirty electricity. That is the things that we have in our store. And your meter on the outside of your house. Think about getting the cover guard for your meter, that little mesh cover guard that goes over it and tightens down on your meter cover. We have that on ours, both at the office and our house, and all my staff have them at their house too. Okay, let's see. Next question. Did you ever find out what the blood work pattern could indicate on Toby's lab? Yeah, I was correct when I mentioned it to you. It's most likely a bacterial infection, but the high monocytes also could indicate what I suggested to was Epstein-Barr as well. But most likely bacteria, most likely it's H. pylori. That would indicate the granulocytes with the bacteria. Could have secondary Epstein-Barr that's resurfacing. So Epstein-Barr is a virus that can live in your nerve ganglia forever, and you can never kill it. So a lot of viruses you could never totally kill, because there's argument whether they're actually most not even living organisms. So Epstein-Barr is one of those that can be dormant in your system, but then when you're compromised anyway, that can come out. And that's what I'm suspecting, because that's what I mentioned. And we talked about getting the liquid berberine from Standard Process, but you said they don't make that anymore. Their liquid golden seal is extremely expensive. You do have access to the core berberine by Energetics that has barberry, Coptis, Oregon grape, golden seal, and lemon balm. That would be a good substitute. So yes, dosage says 30 drops twice a day. Yeah, or you could just do, try just 10 drops at every feeding, not right now through and I think that product is fairly, uh, it's not very viscous, so I don't think you'll have a problem with it, clogging up the feeding tube at all. So I would try this one. There isn't, I mean, look, there's not really any other liquid berberines on the market. But I would give this one a try. That company's a good company. If you can't somehow you can't get it, we can't order that. So let us know, let Megan know, and I can order that. We don't have it on the store, but I can order that. Having continuing issues with constipation, requiring at least 1 to 2 doses of Miralax. Okay. Well, we do not like anybody taking Miralax. It's a really, really poor source of any of a product to help with constipation issues. So what's the best things to take for constipation? Well, if it's just a mild constipation, I would start out with just taking some magnesium before bed. If it's just like I'm not, just don't feel like I'm having bowels, I just don't feel like I'm really emptying my bowels. Or if my issue is I have really difficult bowels, I have hard bowels, then I would take magnesium. Now, when you take magnesium, you got to make sure that you couple that with taking an adequate amount of water. So a person can be constipated because of many issues. So number one, they can be constipated because they're not digesting their fats or proteins very well at all. That can be a major source of constipation. So how would you help support that? You would take HCl and digestive enzymes. So taking and like something like Clear Digest, which has HCl and digestive enzymes and support for the gallbladder, for the bile, that will help you digest your fats, your proteins, and your carbohydrates. Taking that with each meal. That's a digestive aid with each meal. So that's the first thing that I'd consider. Second thing I'd consider, okay, well, let's say I'm already taking that and I'm still having hard bowels and it's difficulty to digest, is start thinking, am I dehydrated? So am I even consuming enough water? So number two, I would just start increasing my water consumption. Well, no, that's not it. I drink plenty of water. Okay, then add magnesium. You could be deficient in magnesium. If you, I mean, magnesium is needed for hundreds of different metabolic processes in your body. So you can't really get too much magnesium per se because it won't harm you. If you get too much magnesium, you just dump it into the bowel, then water is drawn because it's an electrolyte and it'll help loosen your stools. Now, some people will say, I'm taking magnesium and I'm having bowel movements, but it's just really soft and it's hard to know if you're really getting my bowels. Really, it just feels like I'm not moving my bowels very well. Then use this. This is the phase 6 assist. Phase 6 assist is a type of aloe called Cape aloe. Cape aloe helps get your bowel, your metabolic, the muscles around the bowel moving. It really helps you have a much better bowel movement. So if you feel like you're just, okay, let's say you went on a trip and you feel constipated, or you change your diet, you just feel constipated, or you just feel like I'm never really cleaning myself out, take 2 of these phase 6 assists, these Cape Aloe, before you go to bed, and you'll have a really good bowel movement the next day. This is not something that you necessarily need to be on a daily basis. We do have some people that have had surgery on their bowels. They have known connective tissue in their bowels, and they just always have difficulty with bowel movements that take this every day. But for the average person that doesn't have colorectal cancer, never had surgery, and it doesn't knows that they don't have, issues with any connective tissue in their bowels or um, any other issues from that they've it's been tested on a colonoscopy or something like that, then just taking this as needed. So it's always good to have some of this in your cabinet. Really doesn't go bad. Lasts for years, and to take it when you need it, when you feel like you're not getting yourself cleaned out. It's Cape Aloe. Take a couple of these before you go to bed with magnesium and with some water. It'll really help with your bowel movements. Question coming. I just got my Rife machine. How close do you put the light tube next to your body? Well, it depends on if you have the amplifier connected. So if you have that jackhammer amplifier connected to it, then you can put the bulb underneath the bed because it'll go right through the mattress and it'll affect you beneficially. Now, the amplifier is a relatively new addition to the Rife machines. So uh, most of our patients don't have that, don't have the jackhammer. So they're putting the bulb right next to them. They're snuggling with the bulb. But if you have the amplifier, it amplifies the frequency. So it gives it more power. So if you do put the bulb right next to you with the amplifier connected, you might experience some static electricity. Somebody might come, your wife might come and give you a kiss and she gets a shock. Okay. It's just static electricity. It's not dangerous. It's electrostatic electricity. Electrons are forming on the outside of your body. So there's nothing harmful. It's just like when you rub your feet with your socks on the carpet and then you go touch something. Actually, electrons are attaching to the outside of your body and then discharging when you touch something else. So there's no harm in that. But it's not very comfortable. You know, if somebody, your wife reaches over and gets shocked every time she touches you or something like that. So the reason why you would use the amplifier is because maybe you don't like the bulb next to you, you want it under your bed. There's maybe reasons why you'd want it under your bed, you don't want it right next to you. Um, Personally, I don't use the amplifier. And again, most of our patients don't use the amplifier and they just take that off and then just use it, just the bulb connected directly to the machine, red and black connected to the red and black outlet on the machine. And then you put the bulb just next to you in your bed. Um, that's my preferred way. The only reason why I would tell somebody to use the amplifier and to put the bulb under the bed is if they just, have issues with anything in bed with them, or they don't sleep with covers on at all, and the light is annoying or something like that. Is Cape Aloe safe for kids? Most supplements are safe for kids, but you have to dose it based upon weight. So it depends on the size of the child. If it's a 3-year-old that's only, 30 pounds, you'd have to literally open up a capsule and give them just a wee little bit. I would never give a whole capsule to a child, of that weight. They probably have diarrhea all the next day. But there's no harm in say in Cape Aloe for children. It's just a matter of dosing it properly. So if you figure you're taking 2 capsules for somebody who's 160 pounds, how many are you going to give a 30-pound child? You got to do the math on that. And you're going to just open up a capsule and give them a small portion of it. Always with children too, with any supplements, you want to underdose to begin with, and then you slowly build up to tolerance so you can see how they tolerate. Because some kids' systems will, you know, it'll go through them and it'll, then you wish you didn't do that. So did you get my cheek swab? I wanted to schedule one. I want to figure. No, when did you mail it? I don't think I have your cheek swab. So no, I don't think so. Let me look if I did something last week before I left. I was gone for a few days. Um, no, nope, I did not. So did you just, if you just sent it, then we just might not have got it yet. I felt 2 to 3 hard lumps in my armpit, left armpit last week. Both doctors think it's congested lymph nodes and not cancer. Doing self-massage. Should I expect lumps to soften or decrease in size based upon intensity and frequency of massage if it's congested lymph nodes? So, some of the things that would make you think it's an increased lymph node is, have you had a recent infection? I've had a cold, something like that, that could cause that to take place. Was there any other changes? Were you exercising more or something like that? Because you had surgery, it's going to be more easy to get lymph congestion. So if any of those things take place, those give you a hint that it's congestion. If you're doing things to move lymph and it's not changing size at all, um, then yeah, you have to at least think, well, I'll give this certain amount of time that I need to get this looked at. Um, but should I expect lumps to soften or decrease in size based on intensity and frequency of massage? If it's congested lymph, if it's due to an infection, it can increase the size of the lymph node, and it really depends on if the infection goes away, if your cold goes away, or whatever you have going on. If you don't have a cold, don't have any of that kind of history of that going on, yeah, you want to maybe give it a week to see it'll change size. Okay, so if let's say worst case scenario, it's cancer in those spots, giving it more time and doing some other things to try to move lymph isn't going to make it worse. So I would still give more time and air on that side and do everything I can to get motion in there and to get movement out of there. So yeah, keep me informed on what happens with that. I'll be traveling next month and don't want to miss my coffee enema time. It gets to be a lot of stuff to travel with. My thought is to add boiling water to the grounds at night and let it set overnight to strain and use in the morning. Thoughts, tips, or tricks? Okay, so go back to the course. Let me go on the course really quick. Um, and let's see, where do I have it? Maybe it's on this page. There I have a video there, it looks like. Okay, so this page, I'm gonna share my screen with you real quick. Okay, so this is on the membership site. So on the membership site, this is the page entitled Detoxification Details. I have to see if this is oh, I guess it's still working. So we get hit YouTube that takes down videos of ours like literally every week. It's such a fight with the world these days. So you already know how to do coffee enemas. You're an expert on how to do coffee enemas. However, I created an easy peasy way to do coffee enemas right here. And this works really good if you're out and about. So this first step, prepare coffee, is what you're asking about. So literally, when you're out and when you're traveling, just go get some organic coffee and make some coffee in the morning and let it cool or add a little bit of water and do the easy peasy way where you're standing in the shower doing the coffee enema. So just keep it really simple, as I wrote here. Just keep it really simple. Don't stress. You're doing a coffee enema to stimulate your parasympathetics. If you're stressing about doing a coffee enema, you're defeating the whole purpose of doing a coffee enema. You're stimulating your sympathetics to try to stimulate your parasympathetics. So just do it super easy. Even if you have to go buy a cup of coffee at a coffee shop, um, or if you have a coffee maker at wherever you're traveling, just make some coffee, you know? It doesn't have to be done the perfect way. So just do it that way. That would the way I would do it. Um, and make your coffee and then do a standing coffee enema in the shower just to make it easy on your traveling. I'm sending in a urine sample next week. At the moment, I am not on an antibiotic for a minor UTI. Should I stop the antibiotic before sending in the urine sample? No, no. So if you're doing a urine, it depends on what you're doing the urine sample for. So if you're doing a urine sample, um, well, I'm trying to think of what a person what a test, urine sample test would make a difference if you're on an antibiotic, and I don't think there is any. So even if you did a urine sample to test for a UTI, you still wouldn't stop an antibiotic because you're doing the antibiotic for a minor UTI. So you're trying to kill any bacteria that's in there. So no, 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 you don't have to stop the urine. You don't have to stop the antibiotic for the urine sample for a mycotox test, nor do you have to stop it for urine sample for a glyphosate test. If that's what you're doing, if it's the test that we sent you, then no, just do it. You do it tomorrow if you can, or whatever. Do it at the earliest convenience would be better. The antibiotic should not interfere with that. How would exercise congest the lymph? Well, exercise is going to increase circulation. And then increased circulation is going to be dilation of your blood vessels, and you'll increase, um, you know, capillary leakage. You're hydrating the tissue, and your muscles are calling for energy. So you need to increase the blood supply to the muscles. So you're going to have more fluid that's going to need to be carried away then also. So exercise is good for lymph flow too. But if you've had surgery and it's blocking some of the pathways, then that could be an issue. So so typically, if you want to do exercise to improve lymph flow, because you're contracting muscles and you're moving the blood, and it's so good for every part of your body. But if you've had surgery that is, damaged, that has put basically a dam in the stream, that could be an issue. So so it's really the change. Let's say, well, haven't done any exercise that I don't normally do, then that's not it. But if it's like, well, yeah, I had to go and do this. I was working out in the garden, I was clearing this or something. I guess I did do a whole bunch more exercise than before. That could be it. So if it isn't anything you haven't done, if it's normal things, nothing has changed, then I wouldn't say that would be it. But if there was a major change, that could be a factor. If I massage every day but also work out, will I maintain the status quo? Yes, I'll let you know if something is not good. So it's really be the change. And you can have an infection that maybe is subclinical. So if you have a little cold or something like that, that can be an issue. You don't realize that there's swelling that's involved. Any other questions? Okay, well, I think for sake of my throat, we'll stop for today. Um, and make sure if you need anything specifically, make sure you go ahead and use that self-schedule page or get your questions submitted, and we'll make sure we get them on. All right. Goodbye, everybody. I will see you next week. Bye-bye.